hospitals all across the country are seeing a troubling rise in ER visits, all because of the opioid crisis. And thanks for staying up late with us tonight. I'm Scott Levin.
And I'm Mary Alice Demler. The CDC says emergency room visits jumped 30% in 45 states last year.
That's right. The report didn't give us any local numbers here. So 2 on your side's Ron Plant spoke with a member of the county task force to find out what our hospitals are doing to bring that number down.
Our work day or work shift is definitely affected by patients with addiction problems.
Dr. Joshua Lynch says it plays out that way at all local ERs like ECMC, Millard Fillmore Suburban, and other hospitals covered by him and his colleagues at UBMD Emergency Medical Group. They consider the overdose cases just as serious as any heart attack, stroke, or trauma patient, with an additional factor for those who OD.
The patients that hit the emergency department, oftentimes we may be their only interaction to healthcare. So we take the time that we have with those patients very seriously, and we try to maximize what we can do for them both in the emergency department and how we hook them up with treatment.
Lynch says that effort has been enhanced over the past year with a program to set up a network of regional addiction treatment centers.
We have worked very hard to kind of develop affiliations with 5 different treatment organizations across Western New York that have worked with us and given us the ability to start for appropriate patients medication-assisted treatment right in the emergency department, and then rapidly link them into appointments typically within 72 hours of the time they're in the emergency department.
That includes use of specific addiction treatment medication like buprenorphine, known as Suboxone, but the referrals for treatment clinics are just as crucial, especially for repeat OD patients common with addiction.
Getting patients the help and the medication that they may need or might be appropriate for them right while they're in the emergency department and linking them appropriately to an addiction specialist. Our goal is to stop seeing those repeat patients that need Narcan over and over again.
Now, as we've heard before, this opioid epidemic has unfortunately hit hard in all areas, urban, suburban, rural. That's why treatment access has even been set up in more outlying areas like North Collins and even Warsaw in Wyoming County. Ron Plant's Channel 2 News.